All right, so let's go ahead and get started. Thank you all so much for attending the webinar today. Now, this is intended for any clinical staff member who will be involved in screening or generating a community referral summary for beneficiaries. If you're unsure of your role in this project, it's probably a good idea to stick around and learn the screening and referral processes. Now, your microphone will be automatically muted. If you'd like to ask a question, please click the raise hand icon, and I'll let you know when you're unmuted. You can also feel free to type questions in the chat feature at any time. So here's what we'll cover in today's webinar. Module 1 covers background on the Accountable Health Communities model. Module 2 covers the Health-Related Social Needs tool. And Module 3 covers how to use the HRSN screening tool. Module 4 covers some basic topics on how and when to administer the HRSN tool. Module 5 covers how to use the paper-based HRSN screening tool, while Module 6 covers the electronic version. Module 7 will cover some practical considerations when conducting the screening tool and generating the community referral summary, and we'll wrap up with some questions frequently asked by beneficiaries. So Module 1 is background on the Accountable Health Communities model. So I'm going to quickly explain a few of these abbreviations. BO stands for Bridge Organization, which in this case is the University of Kentucky. We're one of the many bridge organizations throughout the country involved in the AHC project. Now CDS stands for Clinical Delivery Site, which is just another way of saying clinic. And HRSN is a health-related social need, which is something like housing insecurity, food insecurity, or interpersonal violence. We'll discuss HRSNs more in a bit. KCAHC is what the University of Kentucky calls the entire collaborative group involved with the project. It stands for the Kentucky Consortium for Accountable Health Communities. A community dwelling beneficiary is an individual receiving Medicare and/or Medicaid benefits, regardless of age, functional status, and cultural or linguistic diversity, who is not residing in a correctional facility or long-term institution, such as a nursing facility, who seeks health care at a participating clinical delivery site, and who lives within the geographic target area specified by the bridge organization. A high-risk community dwelling beneficiary is a community dwelling beneficiary with an HRSN who reports 2 or more emergency room visits in the 12-month period prior to seeking care at the clinical delivery site where the community dwelling beneficiary is offered screening. A low-risk community dwelling beneficiary has an HRSN who self-reports 1 or no ER visits in the 12-month period prior to seeking clinical care at the clinical delivery site where the screening is offered. A community referral summary, also sometimes referred to as a CRS, is a document tailored to each community dwelling beneficiary who screens positive for one or more HRSNs. The summary contains a list of community service providers that may help address HRSNs identified through the screening. Community service navigation involves an in-depth assessment and interview conducted by an AHC navigator. In the meeting, the navigator develops an individualized action plan for the community dwelling beneficiary and follows up with him or her until the individual's health-related social needs are resolved or determined to be unresolvable. So let's answer some basic questions regarding the Accountable Health Communities model. So what does it test? The AHC model tests whether systematically identifying and addressing health-related social needs of community dwelling, Medicare, and Medicaid beneficiaries impacts healthcare quality, utilization, and costs. The KC-AHC project was awarded a Track 3 grant, which involves what's called the alignment intervention, which involves all high-risk community dwelling beneficiaries receiving a community referral summary and community service navigation. Bridge organizations in the alignment track will focus on partner alignment. That is, the bridge organization will ensure that community services are available and responsive to the needs of the community dwelling beneficiaries of interest. Screening for health-related social needs is offered to all Medicare and Medicaid patients 18 years and older, regardless of language, literacy level, or disability status. Let's discuss what exactly a health-related social need is. The definition of an HRSN is one or more needs that potentially impacts healthcare but may not be part of the traditional healthcare system. The HRSN tool, the screening form you'll be handing out, was developed to identify three things. 1, whether a beneficiary is community dwelling or not living in an institutional setting, and therefore eligible for the model. 2, whether a community dwelling beneficiary is determined to be a high risk, defined as a beneficiary reporting 2 or more ER visits in the 12-month period, or low risk, defined as a beneficiary reporting 1 or no ER visits. And 3, whether a community dwelling beneficiary has 1 or more core HRSNs. Now you're responsible to administer the HRSN screening tool, track data on who was screened, and submit data to the University of Kentucky. So these are our participating clinical sites throughout Eastern Kentucky. Highlighted in blue are the 27 counties that are targeted in the AHC project. And here are where all of our clinics are located in Eastern Kentucky. So let's continue to Module 2, which is the Health-Related Social Needs Screening Tool Overview. Now the HRSN screening tool is divided into 5 sections. The first section is Introduction Text, which is suggested text to help screeners explain the purpose of the tool to the beneficiary. The second section is Information, which determines eligibility. Now, these 3 questions help determine a beneficiary's eligibility for participating in the intervention and for completing the rest of the HRSN screening tool. Administration of this section is required, and all questions must be answered before moving on to the core domains. Now, the third section are those core domains. These are questions related to the 5 core health-related social needs, which are living situation, also called housing, food, transportation, utilities, and safety, also called interpersonal violence. Beneficiaries may refuse or skip any question. The fourth section is the supplemental domain. These are questions regarding family and community support, which is the supplemental domain chosen by the KC-AHC as the bridge organization. And the last section is background questions. These are some brief demographic questions. Beneficiaries may refuse or skip any of these questions. So the HRSN tools that determine eligibility to be screened. These are the first 3 questions of the HRSN screening tool, and they must be answered. They determine a beneficiary's eligibility for completing the rest of the HRSN screening tool. Now, answering these 3 questions qualifies as an offer to screen and therefore counts toward a clinic's target enrollment goals. Determining eligibility based on geographic target area. A beneficiary must reside in the KC-AHC geographical target area as determined by what counties a clinic sees patients. If you're unsure of which counties these are, please ask your clinic director or feel free to email us. Question 3 asks if a beneficiary lives in any of a number of locations. The beneficiary must choose none of the above to be considered community dwelling and therefore eligible to participate in the intervention and complete the HRSN screening tool. If the beneficiary does not respond with none of the above, thank them for their time and discontinue screening. Now, a scoring template will be provided to each clinic so that you can quickly score each screening tool. I've highlighted the responses that flag a positive health-related social need just for illustration purposes. So questions 4 and 5 relate to a housing need. Question 4 asks, what is your living situation today? They can respond with, I have a steady place to live. I have a place to live today, but I'm worried about losing it in the future. Or I do not have a steady place to live. I'm temporarily staying with others, in a hotel, in a shelter, living outside on the street, on a beach, in a car, abandoned building, bus or train station, or in a park. And the responses that flag a positive health-related social need are those second responses. So anything but I have a steady place to live. Question 5 asks, think about the place you live. Do you have any problems with any of the following? They can respond with anything such as pests, mold, lead paint or pipes, lack of heat, oven or stove not working, smoke detectors missing or not working, water leaks, or none of the above. And checking off anything except for none of the above will flag a positive health-related social need. Questions 6 and 7 are regarding food insecurity. There's some introductory text that says, some people have made the following statements about their food situation. Please answer whether the statements were often, sometimes, or never true for you and your household in the last 12 months. Question 6 asks, within the past 12 months, you were worried that your food would run out before you got money to buy more. Now, they would be flagged as having a food need if they responded often or sometimes true. And question 7 asks, within the past 12 months, the food you bought just didn't last and you didn't have money to get more. Again, a positive health-related social need is identified if they check often or sometimes true. Question 8 asks, in the past 12 months, has a lack of reliable transportation kept you from medical appointments, meetings, work, or from getting to the things needed for daily living? Responding yes will flag a positive transportation need. Question 9 is the utilities question. It asks, in the past 12 months, has the electric, gas, oil, or water company threatened to shut off services in your home? They can respond with yes, no, or it's already shut off. Responding with yes or already shut off flags a positive HRSN. Now, questions 10 through 13 refer to interpersonal violence or safety. The safety question responses allow a beneficiary to respond with never, rarely, sometimes, fairly often, and frequently. Now, the questions are, question 10 is, how often does anyone, including family and friends, physically hurt you? Question 11 asks, how often does anyone, including family and friends, insult or talk down to you? Question 12 asks, how often does anyone, including family and friends, threaten you with harm? And question 13 asks, how often does anyone, including family and friends, scream or curse at you? These questions are weighted, so each response carries a different score. The weighting will be included in the scoring template that will be provided to you. If the sum of these scores is greater than 10, a need is identified. Now, questions 14 and 15 are the family and community support questions. This is the supplemental health-related social need domain. Question 14 asks, if for any reason you need help with day-to-day activities, such as bathing, preparing meals, shopping, caring for children or dependents, managing finances, etc., do you get the help you need? They can respond with, I don't need any help, I get all the help I need, I could use a little more help, or I need a lot more help. And these last two responses flag a positive HRSN. And question 15 asks, how often do you feel lonely or isolated from those around you? They can respond never, rarely, sometimes, often, or always. And responding with anything except for never flags a positive HRSN. Questions 16 through 21 are the background questions. These are not scored and just provide basic demographic information. Again, beneficiaries could skip or omit any of these questions. Question 16 asks, what is your sex? 17 asks, are you Hispanic, Latino, or of Spanish origin? Question 18 asks, which one or more of the following would you say is your race? And question 19 asks, what is the highest grade or year of school you completed? Question 20 asks them to input how many people they currently live with, counting themselves, their spouse or partner, their children, and any other dependents. If they live alone, they should put 0, 1. And question 21 asks, what is their annual household income from all sources? So Module 3 talks about using the Health-Related Social Needs tool. So Chapter 1 is version of the HRSN screening tool. You'll be using what's called the multi-use version, which encompasses language that is aimed toward beneficiaries answering the tool for themselves, as well as caregivers who are answering the questions on behalf of the beneficiary. The proxy version is adapted for caregivers who will answer the questions on behalf of the beneficiary to be screened. And the standard version is intended only for beneficiaries who will answer questions about him or herself. Again, you'll be using the multi-use version across the board. There are a few different ways the screening tool can be completed. First, the beneficiary can complete the screening tool themselves. They should be encouraged to ask questions or ask the screener to read any questions aloud. Try not to accept "I don't know" as an answer until you've encouraged the beneficiary to give his or her best answer. Proxy-administered screening involves a parent, guardian, or caregiver administering the screening tool. Last, an interviewer can read the questions aloud to the beneficiary and record their answers. Remember, the multi-use version is used regardless of who completes the screening tool. So the screening tool must be made available to all beneficiaries, regardless of language or literacy level. And here are the languages that the screening form has been translated into. If you think you'll encounter patients who speak these languages, please let us know and we'll be happy to provide the translated versions of the languages you need. So Module 4 is administering the Health-Related Social Needs tool. The beneficiary must be provided with an opportunity to complete the HRSN screening tool at least once every 12 months, unless a patient is actively being navigated. There are no limits to how many times or how frequently a beneficiary may complete the HRSN screening tool. This means that if the patient comes in once every 3 months, you can give them the screening form every time they come in. They are, of course, free to decline, but each time you fill out those first 3 questions in the information section, that counts as an offer to screen and will contribute to your clinic's target enrollment. So this is just a general flow chart that kind of shows the various paths a beneficiary can go down. Let's see. So up top, the patient information can be entered into the data system no more than 5 days before the patient's visit. So the first step is the patient enters the clinic and receives the screening form. Now let's say a patient reports 0 to 1 ED visits in the last 12 months. If they then have no health-related social needs, they follow their usual care and no further action is needed, and they can be rescreened at a later date, and the process starts again. If they report 0 to 1 ED visits and they have 1 or more health-related social needs, they'll get that tailored community service referral, and then they'll receive their usual care and no further action is needed, and they can be rescreened. So let's say a beneficiary responds that they have had 2 or more ED visits in the last 12 months. If they then have no health-related social needs, they'll receive usual care and no action is needed. But then if they have 2 or more ED visits and 1 or more health-related social needs, they're provided that community service referral. And then no more than 2 business days after that visit, they'll receive an interview and an action plan with a navigator. And then they'll receive follow-up encounters and or phone calls as needed until the case is closed. Now, a way that a case can be closed is a community service provider is unavailable for more than 6 months, so we don't want them sitting on a waiting list for that long. Or if there's 3 failed communication attempts with a patient, or the patient no longer wishes to participate. And the last way that a case can be closed is 12 months have elapsed since the screening took place. That will automatically close their navigation case. All of these patients can be rescreened at a later date, and the process starts again. So what do you do when a beneficiary asks what the screening tool is for? It's important to review the purpose of the tool, how it will be used, the benefits of their completion, and the confidentiality of their responses. For example, you could say something like, these questions are part of a CMS program called Accountable Health Communities, or AHC. We're asking them of Medicare and Medicaid patients to understand if they need help with areas of their lives outside the clinic. Your answers will be used only for this program and will keep them confidential. You don't need to answer, but you could be eligible for assistance if you do. So here's a couple important points to remember. A beneficiary must have at least one core HRSN to be eligible to receive a community referral summary or be eligible for navigation. This means that if a patient is flagged as having a family and community support need and no other needs, they are not eligible to receive the summary or navigation if they're high risk. Of course, you may feel free to distribute the community resources as you see fit. That beneficiary will still count toward your screening numbers, but won't count toward your navigation numbers if they're deemed high risk. Your clinic should always follow usual care procedures for beneficiaries, regardless of scoring thresholds in the screening tool. For example, that means if a patient reports verbal or physical abuse but falls below the scoring threshold described before, you should still follow your clinic protocols and say refer them to your LCSW. So there are different times when a screening tool can be administered. If you feel that your clinic may be able to conduct screenings in either a pre-visit or home visit setting, please let us know. Pre-visit screening must be offered no more than 5 business days before the beneficiary is scheduled to receive care from a clinical delivery site. They cannot receive the CRS until they show up at the clinic for their appointment. Home visit screening can take place if a beneficiary is receiving home health or telehealth as part of their usual care. Again, let us know if you think your clinic may be interested in conducting the screening tool in these situations. In-visit screening will largely be the majority of your encounters. This occurs when a beneficiary shows up at your clinic for their usual care. If you're located in an emergency department, post-ED visit screenings must be offered in a standardized manner to a predefined population of patients who should not be offered screening during their ED visit, like a trauma patient. The beneficiary should be given the community referral summary within 5 business days of screening. This can be included in their discharge papers, for example. Let's pause here and open it up to any questions. If you want to talk, click the raise hand icon and we'll let you know when you're unmuted. You can also type your questions in the chat box. Okay, no questions? Feel free to type the question in the chat box at any time and I'll address it as soon as I can. So let's pause here and take a 5-minute break. Okay, let's go ahead and keep going. We'll continue to Module 5, which is the paper-based screening and referral process. Each beneficiary who completes a paper screening tool will also need a cover page, which ensures that UK can track their responses and properly enter it into the data system. This page contains demographic information as well as the results of the screening tool. This page will be scanned or faxed and sent to UK along with the screening tool. If a beneficiary is eligible for navigation, the original copy will be given to the navigator. So the top portion here is just basic demographic information. Administered by will be the member of the clinical delivery site that administers the screening tool, and then basic patient demographic information. Now at the bottom of the page, you'll check off what positive health-related social needs the beneficiary has. So let's say our beneficiary has a housing and transportation need, and let's say he had one visit to the ED in the past 12 months, so we'll check low risk here. The patient is allowed to refuse the CRS, but we'll check that he accepted it. Now he had one or more HRSNs, and last he said that he's not receiving any services that may overlap with the project, such as getting navigation services from Kentucky Home Place. So that's how you would fill out the bottom of the cover sheet. It's a good place to also jot down any important information on the beneficiary that you may think will help the navigator, or you think that other staff members should know. So here we've outlined a couple different scenarios for when you can administer the screening tool and provide the community referral summary. The first option is the patient completes the screening tool while in the waiting room. They can be given the tool when they check in and can complete it while they wait to be triaged or taken to an exam room. In this instance, it's important to relay to the patient that they should feel free to ask any questions they may have. A staff member can score the screening tool while the patient is being triaged or while being seen by a provider, and they can be given the community referral summary after the exam. Another option is to give the patient the screening tool after they've been through triage and while they're in the waiting room, or rather the exam room, waiting for the provider. We've been told by many clinics that this is the longest wait the patient experiences. Again, a staff member can score the screening tool during the exam and provide the CRS after the exam is completed before the patient checks out. Now these are just a couple options that we've created. You're more than welcome to fit the screening tool into your clinical workflow wherever you see fit. So when using a paper-based system, your community referral summaries will be pre-printed. Each sheet of paper will have resources for a specific HRSN for a specific county. For example, if a patient was flagged as needing food resources and lived in Perry County, you would give them the Perry County Food Resources Community Referral Summary. Module 6 will cover the electronic screening and referral process. Now, with the electronic version of the screening form, the scoring is taken care of by the system. One option for administration is to conduct a screening with the front desk staff at their computer. The registration staff members can read the questions to the beneficiary, or they can self-administer. The CRS can be generated and given to the patient after the exam. Another method of administration involves triage staff administering the screening tool on their own computer while collecting vitals. This can be done before or after a patient has been placed in an exam room. A common method of administration involves a clinical staff member administering the screening tool in the exam room while the patient is waiting for a provider. This can be done using a laptop, rolling desktop computer, or an iPad. So this next portion of the webinar is going to be a walkthrough of the AHC data system. This is not intended to train you on how to use it. It's just to give you an overview of how the system generally looks and works. So this first screen here, first you'll need to search for a beneficiary even if you know they haven't been screened before. You must enter at least their last name and their date of birth. If after doing that you see a message up here that says no matching beneficiaries found, you can click Register a New Beneficiary. To register a new beneficiary, enter in all information that has a red asterisk next to it, and also include the Medicare HICN or the Medicaid ID. Now, if the beneficiary is already in the system, they'll be displayed on the bottom portion right here. You can scroll and double check their date of birth, their Medicare or Medicaid ID, and their zip code to ensure that you have the correct patient. It'll also show you their most recent visit. So using the scroll bar here, you'll scroll all the way to the right and click View. So this is the beneficiary record. It shows basic demographic information as well as the screening and navigation history. Since this patient is new, I'll click Start Screening here to start the first screening tool. So this is the first page of the screening tool, which includes that identifying information questions. They'll just click the black circle next to their desired answers, and when they're ready to go on to the next page, they'll click the green Next button. Now the patient will proceed to answer questions regarding core health-related social needs in the same manner, and they'll click Next at the bottom of the page. So this is the last page of the screening tool and collects basic demographic data. They'll select their responses and click Submit when complete. After completing the screening tool, the user is shown this page to generate the community referral summary. The first thing you'll do is you'll click the Select Need drop-down menu and select their first need. In this case, we'll say this person has a food need. Second thing you'll do is enter in the beneficiary's county of residence, where it says resource name here, and then you'll click Search. This will then populate relevant resources in the bottom portion here. So what you'll do as the administrator is you'll click the plus sign next to the desired resources to add them to the community referral summary. Once you click a plus sign here, selected resources will appear down here. If you want to then remove a resource, you'll just click the red X. And you'll repeat steps 2 and 3 for each need. So you'll select a new need, enter in the county name, and click search. Click the plus sign next to the desired resources, and they'll appear down at the bottom here. Now once you're done, you'll click Generate CRS. So this is how each resource will appear in the PDF Community Resource Summary that's generated. This is what you'll then print out and hand to the beneficiary before they leave. After saving the Community Referral Summary, you'll be taken back to the beneficiary record. Down at the bottom here, you'll see the beneficiary's screening history. And if the patient is considered high risk, you'll just click Begin Navigation. So this is the navigation screen. Down here, you'll see the current health-related social needs as identified by the screening tool. You can add a need or update the community referral summary using the buttons down here. To document a navigation encounter, at the very bottom you can click Add Encounter. This will pop up a window here, and you'll fill out the details of the navigation encounter. You'll notice that all fields are required. So after you finish entering in the navigation encounter details, you'll be taken back to the navigation record screen, which will now show the navigation encounter at the bottom of the page here. If you want to go back to the beneficiary record, you can just click the blue button that says Beneficiary Record. Now the beneficiary record screen shows a link to the navigation case at the bottom of the page here. It'll also show the handout that you gave if you'd like to reprint that original community referral summary. So Module 2 is going to go over some practical considerations when administering the screening tool and generating the community referral summary. So the first one is evaluating the CMS data system. So we understand that not every clinic is going to be able to do everything. Every clinic will choose to integrate into their workflow differently and choose whether you're going to be using the paper-based version or the electronic version. So we went with a good, better, best type system. So the best option would be to trial the data system and communicate your preferences with UK prior to the July pilot date. The better option would be to trial the system during the pilot period and communicate your preference with UK prior to the go-live date of August 1st. And the good option would be to trial the system during the implementation period and switch to paper if the data system is not feasibly integrating with your clinical workflow. So let's say you are going with the paper-based system of screening and referral. The best option would be to scan the screening forms and cover sheets to a PDF and upload to UK via a secure connection that will be arranged by the UK team. The better option would be to fax the screening forms and cover sheets to UK. And the good option would be to mail the screening forms to UK or arrange a pickup with a UK staff member. So generating the community referral summary. The best option would be to create the community referral summary by choosing resources that the beneficiary prefers and can feasibly access. You can then discuss the resources with the beneficiary. The better option would be to create the community referral summary and point out or highlight relevant resources and briefly discuss them with the beneficiary. And the good option would be to give the beneficiary a complete list of resources for a positive HRSN for the county in which they live. So these are some frequently asked questions asked by the beneficiaries. So a question that they can ask is, what is the purpose of the study? CMS designed the Accountable Health Communities model to address a gap between clinical care and community services in the current health care delivery system by connecting Medicare and Medicaid community dwelling beneficiaries to social support services that can help address their health-related social needs. They can visit that URL for more information about the AHC model. They can ask, what is the survey about? And you can tell them that the AHC HRSN screening tool asks about your non-medical needs, such as housing, food, transportation, paying utility bills, and interpersonal safety. They may ask who is sponsoring the program. The AHC model is sponsored by CMS, a federal agency within the U.S. Department of Health and Human Services. CMS administers programs that include Medicare, Medicaid, and Children's Health Insurance Program, or CHIP. They can ask, is this HRSN screening tool mandatory for beneficiaries? And you can say no. Your participation is voluntary. You do not have to complete the tool. However, if you do complete the tool, we may be able to connect you to services that may help you. They may ask if they're getting paid for the program. And you should say no. You will not be paid for completing the HRSN screening tool. However, if a health-related social need is identified, we may be able to connect you to services that may help you. And they may ask how long it'll take to complete the screening tool, and you should tell them it should take about 5 to 10 minutes to complete. They may say that they don't have time, in which case you can say something like, the screening tool is short and should take about 5 minutes to complete. If you do not have time today to complete the screening tool, you have the option of participating at your next visit. We hope you'll consider participating, as the screening tool may identify services that may help you. If they ask if their information will be kept confidential, you can tell them that all information you provide will be held in confidence. Your participation will not affect your medical care, Medicare or Medicaid eligibility, other health or disability benefits, or any premiums you pay. They may point out the fact that the introductory text says your information will be kept confidential except where law requires mandatory reporting. You can tell them that all states require mandatory reporters who suspect the mistreatment of a child, dependent adult, or elderly family member to report the case for further investigation. Mandatory reporters tend to be social workers, physicians, nurses, counselors, therapists, and other mental health professionals. And they may say that they're not interested. You can say, I understand. However, please know that this tool is available to help you. Based on your responses, you may receive additional information. And they could ask who they should contact if they have questions about the screening tool. If you have questions as you're completing the screening tool, please come talk to me or the person who gave you the tool, and they'll help you answer your questions. So we'll pause here for any questions you guys may have. Again, you can click the raise hand icon or type your questions into the chat feature. Okay, so we'll go ahead and keep going. Now the last part here is just a little bit of homework. Within the next week, please visit the site below and complete a short quiz. It's only about 4 questions. Each staff member who plans on administering the screening tool and/or generating the community referral summary will need to complete the quiz. Now the questions are not scored, but the results will be sent to UK to track those that have taken the quiz. You can feel free to go back to incorrect questions and correct them. There's a link here. I will be sending out the PDF version of these slides, so that link should be active, or you can copy and paste that URL into your browser. And last, tutorial videos are now live on our website. You can click on that link there again, or just copy and paste it. Under the link that you go to, you'll see Data System Tutorials, and just click on the links underneath it. They are YouTube videos. And more videos will be uploaded soon, so check back frequently. So thank you all for attending today's webinar. Again, I'll be emailing out the PDF version of these slides by the end of the day. Now they'll be sent to the clinic contact who filled out the RSVP. Feel free to send them along to anyone in your clinic who you think would benefit, and a recorded version of today's webinar in a video format will be distributed shortly. Thanks again, and have a good afternoon.